Ever feel an itch that just won't go away? You scratch, it soothes for a second, but then, it's back with a vengeance. Well, here's something you might not know. Certain itchy spots could be your body's way of waving a red flag about something serious. And after 60, ignoring these signs might actually shorten your lifespan. Stay with me because today, we're diving into 5 specific itchy spots that could be trying to tell you something important about your health. Let's get started. First, itchy scalp more than just dry skin? Have you ever found yourself scratching your head so much that it feels like you are about to dig a hole in your scalp? While an occasional itch is normal, a persistent and unexplained itchy scalp could be a warning sign from your body. Many people assume that an itchy scalp is just dandruff or dryness, but the truth is, it could be signaling something much more serious. Ignoring it might mean missing an early sign of a health condition that could impact your overall well-being. One of the most overlooked causes of an itchy scalp is diabetes. As we age, our body's ability to regulate blood sugar can weaken, leading to conditions like type 2 diabetes. When blood sugar levels are consistently high, it can cause nerve damage and excessive dryness, making the scalp itchy and irritated. If you find yourself scratching your head more than usual and also experiencing symptoms like increased thirst, fatigue, or frequent urination, it might be time to get your blood sugar checked. Another serious condition linked to an itchy scalp is liver disease. The liver plays a crucial role in filtering toxins from the body. When it is not functioning properly, these toxins can build up in the bloodstream, causing various skin-related symptoms, including persistent itching. This type of itching often occurs without any visible rash, making it easy to dismiss as a minor irritation. However, if your scalp itch is accompanied by yellowing of the skin or eyes, fatigue, or dark urine, it could be a sign that your liver needs medical attention. Skin cancer is another possible reason for an itchy scalp, especially if the itch is concentrated in a specific spot that does not seem to go away. Basal cell carcinoma and squamous cell carcinoma, 2 common types of skin cancer, can sometimes begin as an itchy, scaly patch on the scalp. Because the scalp is exposed to the sun more than we realize, it is at higher risk for developing skin cancer. If you notice a spot that is persistently itchy, changing in size, or even bleeding occasionally, it is crucial to get it examined by a dermatologist as soon as possible. Of course, not all cases of scalp itching are dangerous, but if you have tried switching shampoos, hydrating your skin, and avoiding harsh hair products with no relief, it might be time to consider other underlying causes. If the itch is persistent, severe, or accompanied by other symptoms like hair loss, swelling, or unusual bumps, it is a good idea to consult a doctor. Your body has an incredible way of signaling when something is wrong, and an itchy scalp might just be one of those warning signs you do not want to ignore. Second, itchy hands and feet, a warning from within. If you have ever experienced an uncontrollable itch in your hands or feet, you know how frustrating it can be. It is not just a mild irritation, it can be persistent, distracting, and even disrupt your sleep. While most people assume that itchy hands and feet are caused by dry skin or an allergic reaction, the truth is that this could be your body's way of alerting you to a more serious health issue. Ignoring this symptom could mean overlooking an underlying condition that may affect your overall health and well-being. One of the most concerning causes of itchy hands and feet is kidney disease. Your kidneys play a vital role in filtering waste and excess fluids from your blood. When they start to fail, harmful toxins build up in the body, leading to various symptoms, including severe itching. This type of itching is often worse at night and does not go away with regular moisturizing or skincare routines. If you notice persistent itching along with swelling in your hands and feet, changes in urination patterns, or constant fatigue, it might be a sign that your kidneys are not functioning as they should, and it is crucial to seek medical advice. Another possible cause of itchy hands and feet is peripheral neuropathy, a condition that affects the nerves in the extremities. This is especially common in people with diabetes. High blood sugar levels over time can damage the nerves, leading to tingling, burning, and itching sensations in the hands and feet. The problem with neuropathy is that it can worsen over time, leading to numbness and an increased risk of injuries that may not heal properly. If you have diabetes or are at risk of developing it, do not ignore persistent itching in these areas, as it could be an early warning sign of nerve damage. Fungal infections are another common reason for itching in the hands and feet. Conditions like athlete's foot or fungal infections in the nails often begin with mild itching but can quickly develop into more severe discomfort if left untreated. Fungal infections thrive in warm, damp environments, making your feet the perfect breeding ground, especially if you wear tight shoes for long hours. If the itching is accompanied by redness, peeling skin, or a foul odor, it is essential to treat the infection promptly to prevent it from spreading or becoming more severe. Itchy hands and feet can also be a sign of liver problems. When the liver struggles to filter toxins from the blood, bile acids can accumulate in the skin, leading to intense itching, particularly on the palms and soles. This is often seen in conditions like cirrhosis or cholestasis, where the normal flow of bile is disrupted. If your itching is paired with other symptoms such as yellowing of the skin, dark urine, or unexplained weight loss, it is important to get checked by a doctor as soon as possible. While occasional itching in the hands and feet is normal, chronic and severe itching should never be ignored. If the itch does not go away, worsens at night, or is accompanied by other unusual symptoms, it could be a sign of a more serious health issue. Your body is always trying to communicate with you, and persistent itching in your hands and feet may be a warning that something deeper is going on. Paying attention to these signs and seeking medical advice when needed could help you prevent potential complications and maintain better health as you age. Third, itchy back, a hidden indicator of internal trouble. An itchy back can be one of the most frustrating sensations. You try to reach the spot, twist your arms in strange directions, or even use a back scratcher, but the itch keeps coming back. While most people assume that an itchy back is just dry skin or an irritation from clothing, persistent itching in this area can sometimes indicate a deeper health issue. If the itch does not go away or keeps returning, your body might be trying to warn you about an underlying problem that needs attention. One of the most serious conditions linked to an itchy back is lymphoma, a type of blood cancer that affects the lymphatic system. Many people do not realize that one of the earliest signs of lymphoma is unexplained itching, particularly on the back and lower body. This type of itching is caused by chemicals released by the cancerous cells, which trigger inflammation in the skin. If your back itch is persistent and does not improve with moisturizers, and you also experience unexplained weight loss, night sweats, or persistent fatigue, it is important to see a doctor to rule out this serious condition. Another possible cause of an itchy back is a condition called notalgia paresthetica, which is linked to nerve compression in the spine. As we age, changes in the spine, such as degenerative disc disease or pinched nerves, can lead to sensations of itching, tingling, or burning, usually on one side of the upper back. Unlike a simple skin irritation, this type of itching is caused by nerve signals misfiring, meaning that no amount of scratching will truly relieve it. If you notice that the itching is in the same spot repeatedly and is accompanied by back pain or stiffness, it could be a sign of an underlying spinal issue. Liver and gallbladder problems can also cause intense itching on the back and arms. When the liver is not functioning properly, or when bile flow is blocked due to gallbladder disease, bile acids can build up in the bloodstream. This can cause a deep, persistent itch that often gets worse at night. People with conditions like cirrhosis or hepatitis frequently report this type of itching, which may also be accompanied by symptoms like yellowing of the skin or eyes, dark urine, or bloating. If your back itch is persistent and you have other signs of liver trouble, seeking medical advice as soon as possible is crucial. Another condition that can cause an itchy back is shingles, a viral infection caused by the reactivation of the chickenpox virus. This often starts with tingling or itching on one side of the back, followed by a painful rash with blisters. Shingles can be extremely uncomfortable and, if left untreated, can lead to long-term nerve pain. If your itchy back is followed by a rash or a burning sensation, it is important to get medical treatment quickly to prevent complications. Although an itchy back is often harmless, it is important not to ignore it if the itching persists for weeks, worsens over time, or is accompanied by other unusual symptoms. Your body communicates in many ways, and sometimes, something as simple as an itchy back could be a sign of a deeper problem. If you have tried using lotions and changing detergents but the itch remains, it might be time to look beyond the surface and pay attention to what your body is trying to tell you. Fourth, itchy eyelids, more than just allergies. Waking up with itchy eyelids can be an annoying way to start the day. You might think it is just allergies or maybe a bit of irritation from dust or dry air. But if your eyelids are constantly itching, swelling, or feeling irritated, it could be a sign of something more serious than just a seasonal allergy. The skin around the eyes is incredibly sensitive, and persistent itching in this area can sometimes be your body's way of signaling an underlying health issue that needs attention. One of the most common causes of itchy eyelids is an autoimmune disorder. Conditions like lupus and thyroid disease can cause inflammation in various parts of the body, including the skin around the eyes. An underactive or overactive thyroid, particularly in conditions like Graves' disease, can lead to dry, itchy, and swollen eyelids. If you notice that your eyes are constantly irritated, along with other symptoms such as sudden weight changes, fatigue, or sensitivity to temperature, it is important to get your thyroid levels checked. Another possible cause of itchy eyelids is chronic dry eye syndrome. As we age, our eyes produce fewer tears, which can lead to a persistent dry, itchy, and burning sensation. This is especially common in people who spend long hours reading, watching television, or using screens. Dry eyes can also be linked to conditions like Sjogren's syndrome, an autoimmune disease that affects the body's moisture-producing glands. If your eyelids itch along with a gritty or burning feeling in your eyes, and if blinking does not seem to relieve the discomfort, you may be dealing with chronic dry eye syndrome. Shingles is another serious condition that can cause itchy and painful eyelids. If you have ever had chickenpox, the virus remains dormant in your body and can reactivate later in life as shingles. When it affects the area around the eyes, it can start with mild itching, tingling, or burning on one side of the face, followed by a painful rash. Shingles near the eyes can be dangerous because it can lead to vision problems or even permanent eye damage if left untreated. If your itchy eyelid is accompanied by pain, sensitivity to light, or a rash, seek medical attention immediately. Another overlooked reason for itchy eyelids is an allergic reaction to skincare or beauty products. As we get older, our skin becomes more sensitive, and products that once worked fine may suddenly cause irritation. Ingredients in eye creams, makeup, or even facial cleansers can lead to redness, swelling, and itching. If you recently started using a new product and your eyelids have been itchy ever since, try eliminating it to see if the irritation goes away. While occasional itching in the eyelids is normal, persistent and severe itching should not be ignored. If the itch is accompanied by swelling, redness, vision changes, or other unusual symptoms, it is important to get checked by a doctor. Your eyes are incredibly important, and paying attention to early warning signs can help prevent serious complications. Whether it is due to an underlying health condition or an allergic reaction, identifying the cause of your itchy eyelids can help you take the right steps to protect your eye health and overall well-being. Fifth, itchy legs, a clue about circulation and heart health. If you have ever felt an unbearable itch in your legs that just would not go away, you might have blamed dry skin, allergies, or even bug bites. But what if your itchy legs were trying to tell you something more serious about your health? Many people overlook leg itching, assuming it is nothing more than a minor annoyance. However, persistent itching in the legs can be a sign of underlying circulation problems, nerve issues, or even serious conditions related to the heart and blood vessels. Ignoring this symptom could mean missing an important warning sign that your body is sending you. One of the most common causes of itchy legs is poor circulation, a condition that becomes more common with age. When blood does not flow properly through the veins and arteries, it can cause swelling, discomfort, and itching, especially in the lower legs. Peripheral artery disease, or PAD, is a condition in which the arteries become narrowed due to plaque buildup, restricting blood flow to the legs. This not only causes itching but can also lead to cramping, pain, and even wounds that take longer to heal. If you notice that your legs feel itchy along with a cold sensation, numbness, or changes in skin color, it is important to consult a doctor to check for circulation issues before they become more severe. Another possible cause of persistent itching in the legs is venous insufficiency, a condition where the veins struggle to return blood to the heart efficiently. When this happens, fluid can build up in the lower legs, leading to swelling, a heavy sensation, and intense itching. This condition is often linked to varicose veins, which appear as twisted, swollen veins beneath the skin. If you notice that your legs itch more when you stand for long periods or if they feel swollen by the end of the day, it may be a sign that your veins are not working as efficiently as they should. Managing venous insufficiency early can help prevent more serious complications such as blood clots or leg ulcers. Diabetes is another condition that can cause itchy legs. High blood sugar levels can lead to nerve damage, known as diabetic neuropathy, which causes tingling, burning, and itching sensations in the legs. Additionally, diabetes can lead to dry skin, which further contributes to persistent itching. If you are experiencing unexplained itching along with increased thirst, frequent urination, or slow healing wounds, it might be time to get your blood sugar levels checked. Early detection and proper management of diabetes can help prevent long-term complications and improve overall health. Liver and kidney problems can also contribute to itchy legs. When the liver is not functioning properly, toxins can build up in the bloodstream, leading to itching that is often worse at night. Kidney disease can also cause itchy skin, particularly in the lower legs, due to the accumulation of waste products that the body is unable to filter out. If your leg itching is accompanied by symptoms such as fatigue, swelling, or changes in urine output, it is essential to get a medical evaluation to rule out any serious issues. While an occasional itch in the legs is normal, persistent and unexplained itching should not be ignored. Your body has an incredible way of signaling when something is wrong, and paying attention to these signals can help prevent serious health problems in the future. If your leg itching lasts for weeks, worsens over time, or is accompanied by other unusual symptoms, it is important to seek medical advice. Early detection and proper care can make all the difference in maintaining your health and well-being. Thank you for watching. If you enjoyed this story, be sure to check out more of our videos. We have plenty of inspiring and powerful stories waiting for you. Don't forget to hit the like button, subscribe, and turn on notifications so you never miss an update. See you in the next video.